this field, as well as pretty much most fields, things are always changing. You have to keep up or you're going to be left behind. And you don't want to be practicing outdated techniques or use outdated materials when there are far superior techniques. It's what you would put in your mother's mouth, what you would put in your kid's mouth, right? Like, you want to do what's best for the patient, and you want to do what you would do for your mom or for your kids. Let's take silver fillings, for example. Why do I no longer do silver fillings? If you took a nail and put it into a piece of wood, 10 years later, 15 years later, nothing happens to the nail, but the wood around the nail will start to split. That's exactly what happens with these large silver fillings. Unfortunately, you're putting something extremely hard into, something that has some elastic quality. Then it's just a cycle of, once the tooth cracks, maybe you'll have to put a crown on it, and maybe then you need to do a root canal, and then the tooth needs to come out. You want to be forgiving to the tooth right off the start. I haven't done a silver filling in over 10 years. Adhesive dentistry is huge. The resin fillings, they will last a long time, they give very good aesthetics, and these are the materials that we use. So there's always a constant improvement on materials, techniques. They're just constantly testing. I don't know if you've ever been to IKEA where they have this thing like pushing on a chair just 1,000 times. That's what they do with these dental material. Try to break these fillings off of teeth. That's how they test. It's always moving. It's not even just technology, but 20, 30 years ago, whatever you read in the textbooks, or that was it, right? But these platforms that we have, Instagram, Twitter, they're amazing because you can really see what people are doing out there. I see great dentistry coming out of the Middle East, out of Brazil, just Italy, just everywhere. Now you can see, wow, you know what? These things can be done, and they're lasting a long time. They don't just look good, but they actually work well, and patients are the better for it.